Okay. Thank you. So sorry.
Okay, are we good?
Yes.
Okay, perfect. So the first thing I kind of wanted to go over is what is One Health? Whether you're a new volunteer, if you've been with us for a long time, it's kind of a new concept for us over, I've been with Michigan Humane about 3 years when we really kind of started doing this. And I have a definition up here. There's actually multiple definitions, but, really what a One Health concept is it has to be a collaborative approach that addresses the whole community. So it's the people, the animals, the plants in our shared environment. So it's not one organization that is involved in this. It's a whole bunch of people to really make a healthy community with human resources and environmental resources and community that we all kind of work together to make a healthier community. And then the next thing I wanted to talk about, as we move in talking about community vet, where we offer free services or very low cost services, one of the things I hear, and I've heard it from my own friends and family, I've even thought it too, right? Well, if someone can't afford a pet, then they shouldn't have them, right? And it seems very, very simple. But, we know that there's much more that goes into that. Animals aren't necessarily a luxury item, right? Our love, our income does not dictate how much we're going to love our pets. And we see a neglect and abuse cases from all economic environments. I don't know if everyone remembers Michael Vick and dog fighting, right? Had millions of dollars and did such a horrible thing. And the people that we are helping are not those type of people, right? We have a whole cruelty investigation and a whole team. These are people that have a bond and love their animal, and they want it in their home. And so that's kind of the people that we are targeting. And when we look at our economic status, and we look in America, there's so many people that are just really 1 to 2 paychecks away from financial ruin. I'm older now, but there's many times I've been living paycheck to paycheck. And it really just takes one major thing to happen, a death of a spouse, an illness, you lose your job, to where someone all of a sudden could care for the pet and pay for it. And now they can't anymore. And a lot of people, when they take animals, maybe they weren't in a bad situation financially. But there are also people that, they are poor, right? They don't have a lot of money. But, there's a study done in Boston that shows that, people aren't buying, most of them aren't out buying pets. They're not getting them from breeders. They're actually rescuing them from their own environment, their own communities, from people who have been evicted or passed away, or they see animals in the streets. We know Michigan weather, right? It's 100 degrees in the summer, it can be freezing in the winter. And, they may not afford medical care, but it's better than seeing them suffering in the streets or when they're going through the garbage. So they're actually taking them in and building that bond with them. And, we know that animals are our companions, our protectors. They're a source of unconditional love. They teach our children empathy. And, the goal of this program is to keep pets with their people, because we know how much they mean to people. And the type of community that we go into, right, they suffer a lot of trauma, and they live in an environment to where they don't have a lot of help. It's hard to get out of that, and they suffer that all the time. And sometimes these animals are their only connection to another living being, or very little that they can have and trust. And some of these animals keep people alive. They really do. That bond is so strong. So the goal of I think Michigan Humane and Community Vet is to just because you can't afford it doesn't mean you shouldn't be able to share what everybody else can share that has money with the pet. Next slide, please.
Yeah, I see, Jen, if you raised your hand, do you real quick have something you wanted to add to that?
Yeah, I hope you don't mind, Doena, but I just want to add what you're saying resonates with me so much. My background, I grew up in a family who did not have a lot of money. we grew up, actually, I grew up in the city of Detroit. I didn't move out until after I graduated from college. And the way you talk about folks in the city getting pets, never did we adopt an animal from an animal shelter. Every animal that we had in my home was an animal we found as a stray on the street. And we didn't really, I mean, if a pet was sick, of course, we looked for a veterinarian. We looked for a way to take them in because we didn't want them to suffer, or for them to not be well. But I was one of these families where we saw an animal on the street, we didn't want them to suffer, and we brought them into our home. And when I started working for Michigan Humane, I learned so much, and I was so grateful that we are there and a resource for these people, because I couldn't imagine my life growing up without my cats and the pets that we had in our home as a family. It was really, really crucial to my upbringing, and I think that's why I am where I am now, is because of my bond with my animals. So this is amazing stuff, and really great work.
Thank you for sharing. That is great. So how does community vet fit into One Health? So there's kind of three categories. One is it can help make healthier communities. The obvious one, right, is that we have healthier animals, and it also helps to adjust the shelter focus, and we'll explain that a little bit more in a couple of slides over. You can go ahead to the next slide. So healthy communities. So we know, and there's been a ton of studies out, that having pets in the home can improve your quality of life, or, for humans. I think the one that resonates the most for me is, decreasing feelings of loneliness and anxiety and PTSD. I have learned to manage, but, I've had many years with anxiety and panic attacks, and my pets have been there for me and have been a great support source for me. I was lucky enough to have family too, but I know there's people that don't. And so, that resonates a lot with me. But one thing I find really interesting too is that not only does it help our mental well-being, it actually can physically change our body. 34% less people are less likely to die of a heart attack and stroke. According to the CDC, it can decrease blood pressure, cholesterol, triglyceride levels. So amazing things that can do. It also helps prevent zoonotic diseases. So when we go out, there's roundworm and hookworms, which are intestinal parasites that we treat animals for. All these things that are labeled here are contagious from animal to people. That's what the zoonotic disease means. There's leptospirosis, which is a bacteria. There's ringworm, which is a fungus. And being able to go into these homes and catching some of these and vaccinating them helps to have, safety for humans. We also know that dogs with access to veterinary care and socialization and that are exercise are less likely to bite, thus helping with bite prevention in the community. Next slide. Healthier pets. So community vet care can reduce parvo disease, which is a viral disease that we see in young dogs and puppies. If you've been around the shelter, I'm sure you have heard parvo go around, or heard that it's been in our shelter. We vaccinate for distemper, rabies, leptospirosis, which again is a bacterial disease that they get from other mammals, mostly rats, which we definitely have in our area. I live in Sterling Heights, and my cats I have one cat that goes indoors and outdoors and has brought a rat home before. I've seen them rubbing through my garbage if I don't have the top on all the way. So it's around. We test for heartworm disease. It helps with flea and tick-borne diseases, and it helps with unwanted litters through spay and neuter services. So we really know that pets staying in the home is better health for them and the community. Next slide. Shelter focus. So this shepherd right here, she is an actual patient. She had puppies, and she had a big litter. It was either 8 or 10. I can't remember the exact number, but it was a very big litter. And the woman that took her, she was a stray on the street. She saw her outside, saw that she was pregnant, and took her into her home. And literally that next day, she gave birth on her living room floor. She called Michigan Humane. I was like, oh my, what do I do? Can you take this mom and puppies? And we were not in a position to take them because, usually our shelter is pretty full, and, taking in a mom dog and babies is really our last option. It is not the best place for them. Stress on the mom is extremely high. The risk for disease in the puppies is really high. So if we can avoid keeping them out of the shelter, that's what we want to do. So we talked to this lady about our Wait for 8 program, and she said yes, she was on board. So she took care of these puppies for 8 weeks. We went out and dewormed them. We went out twice to vaccinate them. And what's great about this is, before these puppies even come in, they've had 2 vaccines. We know ahead of time that when they're due, we know when they're going to be 8 weeks old. So we set up surgery. So it really limits the time that they're in the shelter, which is better for everybody. It's better for the puppies. It's better for everybody all around. We reduce surrenders for owners who can and want to keep their pets by providing these low-cost services. Some people, they don't want to give up their pet, but it's got an ear infection and it's painful and it's crying, and they don't want to sit there and see their pet in pain, but they don't know what else to do. And if we can go out and treat an ear infection, keep that pet out of the shelter and in the home, then that allows us to focus on the animals that really have no other options, right? They don't have a loving home. They don't want somebody that wants them. They're a stray in the street. And so that allows us room to take those type of animals. Next slide. So community vet. So really kind of put up here, what is our definition of our community vet program? So this was established to reach a client base that has financial concerns and a lack of transportation or consistent transportation. Or it could also mean that they have health concerns. So they have physical limitations to where they can't physically get into the clinic. And we've had clients that have had knee surgery. I believe we're seeing one soon that had spine surgery. So they really can't. And if they have a big dog, that just makes it extremely challenging for them. We currently serve the Detroit area, and it is by referral from our community solutions team, field services, Michigan Humane Veterinary Clinics. The call center can now do referrals. And we focus on mostly preventative care and some minor medical issues. There are certain cases with approval that Dr. Cece could go out and maybe a more serious case for a client that doesn't have transportation and build that client-patient relationship. So it may be that we can't help in the field. It needs x-rays or it needs blood work. But once we establish that patient-client relationship, then our field service team can help bring that animal to our clinic to get that additional diagnostic work. Next slide. So what are our qualifiers for the program? So some, just to kind of reiterate before, it is right now referral from within the organization. So this isn't necessarily public knowledge to where we are, everybody come in, we have a traveling vet. We want to make sure we are capturing the right type of clients for this program. And again, they don't have transportation to get to the veterinary clinic due to physical limitations or other means. They have a financial concern. Now, normally we can do this at no cost. We don't want finance to limit our services, but we do try to ask for a cost share, and that's typically around $25. Some people can do $25 a pet. People don't necessarily always want free services, and they feel good even if they can give you $5. So we don't say that you have to have it. We say if you can, that's wonderful. It helps go back into the program. And I know that when people can, and I know people at the first visit they couldn't do, but if we go back, they save up and give us money. Or if we set up their pets for surgery, then they put money towards it. So they try to do what they can, which is great. Next slide. So actually, what do we really do when we go out? So our main focus is preventative care. So we are focusing on vaccinating. So we will do the distemper lepto vaccine and rabies vaccine in dogs, and cats will do rabies and our FBRC, which is feline distemper vaccine. We heartworm test. We will run feline leukemia FIV testing on our cats, which feline immunodeficiency virus are a blood disease. So we will test if appropriate. We will provide heartworm prevention and flea prevention. And what's really nice is we have a product called ProHeart, which we can give. It's an injection that protects against heartworm disease for a whole year. So we give it once when we go out, and then that dog's protected for a whole year. That dog also will not be a carrier. So another mosquito can bite to give it another dog, which a really good product. And we don't have to worry about compliance with someone giving the medication, because I know I'm horrible about it. I should be better. So I even get my dog the ProHeart injection. We do, if someone wants microchipping, we do offer microchipping, because we know dogs that are microchipped, we can get them homes, right? It's easier. They don't get stuck in the shelter. Whose dog is this? So we try to encourage microchipping as much as possible. We also set up spay and neuter in the clinic, and most people want their dogs spayed and neutered. Most are like, yes, please do. Let's get them in. We don't want any more babies. We also focus on reactive care. So reactive care, it'd be minor medical issues. So this could be skin issues like allergies, ear infections, upper respiratory infections. We see a lot in our cats. Sometimes lumps and bumps we will take a look at. And in special cases, we will triage animals. And we actually will talk a little bit of story about one here in a little bit, on an animal that Dr. Cece was able to triage. Next slide. And community solutions. So Mark was not with us today, but he is part of our, human health services, our community resource. So, he goes with us because sometimes these people, we're here just to help their pets, but they need other help, right? That they need help with pet pantry and pet food. Sometimes we realize maybe they need help with human food, dog houses and straw. There was one gentleman, which we'll talk about a little bit later too, that needed help with heat. So they were able to go out and get him set up with some programs to help him get heat. We partner with, if you've been to any of our One Health like on-site clinics, we partner with Wayne Health, and where they did vaccinations, blood pressure checks, they checked for diabetes. And sometimes this is the only medical care some people get that whole year. We partner with Delta Dental for human teeth cleaning. So again, that one health approach, being able to do animal health care and with community solutions. Next slide. So some stories. So two stories. These are two patients of ours. We have Lucky and Missy. So I'll go over Missy first, and Dr. Cece is going to talk about Lucky a little bit. So Missy, I think her story is great because it was really a team effort. Our cruelty and rescue team was involved. Community Solutions was involved helping this gentleman, and then community vet. So it started with our cruelty and rescue department, had a relationship with this gentleman. They were offering him, bringing food for him, for his dogs. And they noticed that Missy, she's the big black dog there, had a skin condition. And the owner really did not want to give up his dog. He had lost his wife, was just going through a really, really hard time. And I was doing a ride along, and they said, hey, can we stop by? Do you think, this would be good for Dr. Cece to see, can you guys do this with community vet? So we stopped by his house and took a look at the skin. I said, yeah, I think that's probably something that, we can take a look at. I'll talk to Dr. Cece and, we'll arrange something to come out. And as we were leaving, he had one of our cruelty investigators stay behind and didn't want us involved. You can tell he was the owner was kind of embarrassed or wanted to be private. So we stepped away. And that's when he told them, I don't have heat in my house, right? And winter's coming, and entrusted him with that information. So from there, we were then able to have Community Solutions go out and work with him on the computer to help set him up with, an outside source to help get his heat fixed. For Missy, we were able to give her allergy medications, flea medications, and her skin improved. We did preventative care on her. And she is heartworm positive. So we are working on treating her at a kind of like a slow kill method that we do. But you know, she's improving. We were able to keep the pets in the home. The little Chihuahua back there, we did blood work, which was overall good. She's a little spicy little thing. We weren't sure if we were going to be able to do stuff with her, but once we got her into our little arms, she calmed down. But she just prefers to be curled up by herself. But right now, Missy and the other little one are doing really good. And Dr. Cece, do you want to talk about Lucky?
Yeah, so Lucky, who actually has turned out to be probably one of the nicest dogs I've ever met. The call came in that somebody was walking their dog and another dog ran up and attacked Lucky. So Lucky was just minding his own business, got attacked. And I think you can see from the one picture there on the top of his head, he had a really serious bite wound to his head. And when the owner called, she really thought the dog was going to die. And I said, well, I probably can't treat it out in the field, but let me go take a look at it. Let me triage it. And then I'll talk to the owner. We'll develop that owner relationship. You know, by Michigan, I have to have a relationship with the pet and with the owner in order to treat that animal. And it has to be in person. So I had to go out there. And when we first saw Lucky, he was curled up in his bed, hardly moving at all. And the owner said that my dog can't even move. And he had this big hole in his head and there was blood all over. And I said, well, this is certainly something I can't treat here, but let's see if we can get, now that I've talked to the owner, I've told her what we need to do, let's see if we can get rescue to come and bring Lucky into the shelter. So that's what we did. And of course, you know, Lucky looked like he was dying when he was at the owner's home. And as soon as we got him into the shelter, well, then he stood up and said, oh, just kidding. But he was still seriously injured, but not as bad as we thought, but he needed a lot of care. So he was in our shelter, I think, for 3 or 4 days, antibiotics, pain medication, wound care, and he started to respond and he started to get better. So the owner wanted him to get all his shots and get neutered before he came back home. So we set him up for that. And the veterinarian that was going to do the neutering, she said she did a little blood work beforehand. And she called me up and she said, hey, just so that you know, Lucky's blood count is really low. Do you think we should put him through surgery? And I said, no, that's pretty low. Maybe he lost blood during the attack. And let's give him a few days, maybe even a week, have his blood count come back up, and then we'll put him through surgery. So we sent Lucky home with his medication. And I will tell you, this woman really loves Lucky. I mean, this woman is so bonded to this dog. It's just amazing. And I can see why, because he's such a good dog. And so he seemed to get better. And so we went back out there, Doena and I, we said, well, we'll take some blood, see how his blood's doing and see whether we can schedule for surgery. Well, we took blood and not only was it not good enough for surgery, but it actually was worse. And not only his red blood cells, but his white blood cells were dipping too. So it looked as if his bone marrow was just giving up totally and not producing any cells. And that's really dangerous. And most of the time when that happens, it's cancer. So we obviously, she didn't have the means to take the dog and have him treated at a specialist. So I said, well, let's see what we can do. There are some things that we can try. And so we put him on medication to kind of see if we could get that blood count to come back up. And in the meantime, he developed, I don't know if anybody's had this happen, but he developed an old dog vestibular syndrome where she called me up and said, oh my gosh, he's got a head tilt. His eyes are going back and forth and he's circling. So it's what we call idiopathic. We don't even know why it happens, but idiopathic vestibular, and they do. It's terrifying to the owner. Their eyes will go back and forth. They'll start circling, they'll develop a head tilt. And the good thing is that typically they get over it. It's just, it's very scary for the owner. So she was actually able to bring the dog in at that time, and we gave him medication, send him back home, and he got better. So now he's better. He still has a head tilt because sometimes that head tilt doesn't go away. But when Doena and I go up to see him, he runs up to the door with his head kind of turned to the side, but wagging his tail and very happy. And believe it or not, the medication that we have him on, which I told the owner I wasn't sure that it was going to work, is actually helping. And the last time we went out there and checked, his blood count is actually, both his red blood cells and his white blood cells are almost into the normal range. And, you know, that's something that I never promised her that we would be able, that would happen, because I was really worried that he had cancer, and he certainly could still have cancer. We might have just bought him some time. But this woman loves this dog so much, and this dog is so good. You treat him, you take his blood, he just sits there and wags his tail and gives you kisses. And so if nothing else, we've been able to keep that dog in the home longer and continue that bond that that owner has with that dog for longer. I'm hoping that this all resolves, and maybe we'll never know what started it, but maybe he'll get better and go on to live several more years. We just don't know. But it's very rewarding to see that dog get better, because otherwise, if we weren't there, that owner would have more than likely had to surrender her dog and have it put to sleep. There's no way that she could have gotten that dog into an emergency clinic and treated it. So I think you can see by the picture there with Lucky in the middle that he's doing good. And he's just, like I said, he's just one of the nicest dogs that we've ever had to deal with.
I'm going to go ahead and just jump in real quick while we are wrapping up that. I love both of these stories so much. I'm so glad that I didn't hear them before this. So I was like very intently listening. I love this so much. And I think that there's a lot that especially volunteers can kind of get out of this. It's obviously showing a lot of things that are happening behind the scenes that we're not, necessarily aware of. I know a lot of times we walk into the shelter and we see all of these animals in these kennels. We're like, oh my gosh, we're full. There's so much. Why are they here so long? Why has this animal been here for like 3 weeks and nothing's happened with him? And Dr. Cece, you mentioned right there that it went from maybe a 2-day thing that you were hoping that you could help figure out to like another week where you had to wait. And so sometimes that's the case, is that they're just things kind of keep happening, or we're trying to figure out medical work and it's progressing their time that they're here. And then going back to just sometimes the animals that are in our care at the shelters aren't necessarily animals that are going to be making their way up to the adoption floor. And that's not necessarily a bad thing. That's meaning that hopefully these are dogs that we're holding on to go back home. And they're here as a safe space to help make sure that we can monitor them while they're in our care. So I know just for you guys as volunteers, I know sometimes you walk in, it's so overwhelming, but it's really nice to know that some of those cases that are here with us are going to have an outcome like this. And there's a reason that they're here for a longer period, is because we're helping them so much. So I love to hear that. And thank you for sharing.
I just want to add too, like, I can't even imagine what that owner was going through when you see your animal suffering and you're concerned, like, oh my God, what am I going to do? I don't know how I would afford this. So like the thoughts that are just racing through your brain, do I really have to give him up? Do I have to put him to sleep? Like, no one wants to go through that. I can't even imagine. So I'm so glad we were there to step in and offer a different alternative, because I think you're absolutely right, Dr. Cece. That would have been the only option in that case, or the dog suffers and dies at home because someone is embarrassed to come and say and ask for help. So I mean, this is really, really important stuff. These are just 2 stories, but we hope to do more and more like this, build up our resources to be able to do this. I mean, again, I've gone through a pet that's needed critical care, and it is the most de-stressing thing ever. It's one of the hardest parts of being a pet owner.
Right. And even if we had gotten Lucky through his initial, it would have been really difficult to put this dog up for adoption. By the way, he doesn't have any blood cells and he might have cancer, and who's going to adopt a dog like that? But this owner took him back, and she has given him his medication faithfully. She doesn't have a lot of money. She doesn't have a lot, but boy, whenever we are out there for her dog, she is there. She is giving the medication. You can tell she really loves that dog, and he's in the best place ever.
All right, so Doena and Dr. Cece, thank you so much for sharing the first portion of this presentation about what Community Vet is, what One Health is. I hope you guys learned a lot of that, and we're gonna move into kind of talking about how you guys as volunteers get to be a part of that. So let's go ahead and jump in. So a couple ways obviously this community vet specific program for us going out into the homes and doing this care is not quite to the point of needing volunteers with that. We don't know if that'll ever happen, but that would be fantastic. So keep your ear out if you're interested, but there are things that you can start doing right now that are related to the same type of topic. Making sure that animals stay in their homes and are healthy and happy. One of those ways, really simple, is to help with our One Health events. These happen on site at our shelters, at our Detroit shelter, at our Westland shelter, as well as our Rochester Hills shelter. It is still going to be happening there this year. So this is an event where we open it up to people in the public to come and get this kind of vet services. So these vaccines, microchipping, on site, they can do surgery needs like spays and neuters. When we're off site, we don't do those, but we need volunteers to help with this, as well as helping with food distribution at our gleaners locations that we have. So those are happening more on a regular couple times a month basis at the gleaners facilities. We're going to be giving out pet food to people who are already showing up to get their human food and saying, hey, do you also need some pet food? I'm sure if you need this, you might also need some pet food, and making sure that those are available to people. And then also our home deliveries program and making sure that we can get pet food and sometimes some human food, depending, out to our community. Partner up with a buddy and sign up and go out there. And we're going to only be growing that. So please look forward to a lot more that's going to come with that program. And for any of these type of community events, these are people who maybe are, we talked a little bit about how people can sometimes be embarrassed that they need this help and that they feel like, you know, it's just hard to say you don't have money for something. So we really are looking for volunteers who really enjoy talking to all members of the public. And we need help just directing traffic, directing guests, with registration. You can see in this photo right here, we have a couple volunteers sitting at the front table. We've got one checking in cats and ones that are checking in dogs, giving them a number and sending them to their next spot in line so that they can come and get their services that they need. And then we also often have a pet food tent at these locations. So if you're willing to help load up some dog food or cat food into people's cars, or at least just passing it out and making sure they know it's available, that's super duper helpful. We have volunteers just walking up and down the lines of people, talking to them, seeing if they need any help holding their animal for filling out paperwork or anything like that. So there's a wide range of things that you can do to help with this. And every time we're in one of these events, I hear from the volunteers that everyone leaves so grateful. They're saying things directly to the volunteers when they walk out, saying, thank you guys for being here. I don't know if I was going to be able to afford this right now. And then you were here and I'm just so grateful for this. So it's always a really, really rewarding event if you do have the opportunity to come and test it out with us. And for just any of our events, if it is available on your service profile, you are welcome to sign up and try. So if you see that pop up on there and you want to give it a shot, please do. We're happy to have you.
Not to mention you get to meet a lot of cool pets out there.
I know we could show you some pictures of like, I think one of our events, we had volunteers holding a whole bunch of puppies that came in and needed their vaccines. And we've got like the prettiest random color French bulldogs showing up. And, you know, it's a lot of interesting, fun stuff. And people share their stories there too, which is fun. While they're waiting in line, they'll tell you all about how they found this dog and how they saved their life because they were feeling down and out when they just showed up and suddenly it was like a miracle that this animal was here to help them. So beautiful stories come out of that too. And then so spreading the word is another way that you guys can help. If you do have, I know as volunteers, you are at the Humane Society, people know that you're here, same thing happens to staff, they know that you are somehow connected to this type of service. So a lot of times they show up and say, oh my gosh, I have this, or my friend has this thing going on, can Michigan Humane help me? And sometimes you don't know what to do with that and you want to help, but you just don't know. And I know I get those emails all the time, and the quickest way to help them is just send them to the call center. If you're not familiar with our call center, it's not like this big computerized call center. It's actual staff members that are trained to be doing these calls. They have so many references and things that they can share with people. They always answer the phone with so much compassion and care of what the situation is. They want to hear what's going on so they can properly direct them to where they need to go. So direct them to the call center for anything. If you're not sure, that's the best place to send them. They're there to give assistance, screen those people for what they need, and help refer them. Sometimes it's referring them to a different department that we have, but sometimes it's referring them to an outside resource. Maybe we know of a vet center that can help them close to them if they're calling kind of out of our range. Maybe we know, another place that gives out pet food if they're not here and can't make it to one of our events. They have, like I said, a big list of things that they can help them figure out. And sometimes too, this is kind of a thing that we don't know a lot, but they can help refer to shelters for humans or places that can help give care if they're down and out. They have those resources, connections, and oftentimes with lists of places that accept animals too, because we know that that's why they called us. They can help set up those appointments for things, especially with something like community vet care, or if they are looking for some type of medical needs with us, they can help set up those right on the call, as well as offer guidance. Sometimes people call us and they just don't know how to deal with something themselves. And so we can help give that information over the phone as well. Another thing that you can do is just tell other people about our services. So if people are like, man, I can never get into a vet and I really need to, it's really hard because I can't afford it and I can only afford it when I have my paycheck or something like that. Maybe one of our One Health events will help and talk to them about those and share the knowledge that you learn from this of what these types of events are. They often provide vaccines, microchipping, surgery on site if needed, and we also have like dog licenses for Detroit when we have those. So we have lots of different things, and we'll share those with volunteers when they're coming up, so you guys know exactly what's being offered at each one when they happen. Let them know that we have clinics on site. I don't think everyone probably knows that. They might have had their same vet forever and maybe they don't have that anymore and they're looking for lower cost needs. A lot of times we can offer some lower cost options or work with them on that. So send them our way for those kind of things too. And then we have pet food pantries. So we do have a pet food pantry location that is in a bit of a transition right now in Detroit, but we also have small pet food pantries out of each of our locations. If you don't already know, most everything that comes from the community that is donated goes back into the community in a way. If all of our food and litter is donated by Purina for the shelter. So we are usually pretty good unless there's, something that we really desperately need. So those half-used dog food bags and things that come from the community, we set back out for the community to take. So those are fantastic. And you donating to those is also another way to help the community. And then the last one here, just sharing flyers for events. Feel free when you see them come across in an email or something from us, share that same flyer, or you see it at the shelter, pick one up and share it on your Facebook page, on your Instagram page, whatever you have, as well as just maybe see if you can post it in a local PetSmart or something. You never know. So there might be a place that you can put those out for your community. Maybe you're on your community board or something, you can share that as well. And then our community vaccination partnerships. So any of those type of things that we have, we just are having one this Saturday in Westland. They're kind of having an event for vaccinations in Westland, and we are there as a support. So it's a little bit different than the ones that we put on ourselves, but we do help with a lot of those. So from time to time, you might see those as well. All right. And then another way, of course, is to be an advocate. So you being a volunteer with Michigan Humane, you're part of this team, right? This is part of why we want to give you so much of this information, because I want to make sure that you can answer these questions and feel confident when people ask you things, just like a staff member would. The biggest part that comes along with that is having an open heart and open mind. I really hope that you felt something from those stories. I know I did, that Doena and Dr. Cece shared, of just having a bigger idea of that maybe people aren't wanting to surrender their animal just because they don't want them. Most of the time that is not the case. A lot of times it is because of life circumstances that have just fallen upon someone and suddenly things are different, and they have to maybe make some hard decisions. So kind of keeping that open mind for them, always creating a welcoming space. If you are out at the events or someone stops you in the shelter, try your best to just be, a smiling face. And I know so many of you guys do that already, but just keeping that in mind, that sometimes it's hard. And sometimes we do go to these events and people are stressed out and they maybe have a little bit more of a I don't want to call it an attitude, but just like a tone of their voice that you're unexpecting. It's always important for us to be that positive space for everyone. And to feel like we don't have to be something that they have to fear. Unfortunately, there's still an idea that if I give up my animal to Michigan Humane or any humane society, something bad is going to happen to my animal. And really, that's not the case. We want to be that welcoming place that people feel like these people are going to help me. These people are going to make me feel like I'm doing the right thing, no matter what that is. That's a huge concept that we make sure that we include when we talk to the public. And then stop and ask why. So not maybe ask the person why they're surrendering their animal, but stop and ask yourself why that might be happening before jumping to that quick, oh my gosh, I could never do that. I love my animal too much. Take a moment to reflect and go, I bet they love their animal too, but they're struggling with something, and I should be really thoughtful about how I talk to them. Expanding your learning with us is another way that you can be an advocate. So just how you guys are doing it right now, you're part of something, you're learning something new, you're expanding your knowledge with us. So thank you all for being here and doing that, taking that upon yourself to want to know more and learn how to be a better volunteer, be a better community member. Some of the other ways that you can do that is when we have our virtual with the vet, learn about some of these diseases that we talked about, or some of these health concerns that we talked about today when we do have those come up. I know we've just had one recently, but hopefully we'll get a couple more of those coming out so you guys can learn about some things. So when people are concerned about maybe having something wrong with their animal, maybe you have a better idea of what might be going on. Joining our volunteer Facebook group. This is a great place to learn about what's going on. I know not everybody has Facebook, and that's okay, but this is a fantastic place to find out some of these events that we have, as well as the emails. It's a nice place to just talk to other volunteers about what they're doing too, and get that community kind of aspect going from within. Learning about our partners, we will be talking more about them this year, some of the things that they do and support us with. And then our learning about some local communities and their needs, learning about your own community. I know a lot of our stuff seems Detroit heavy, and if you're maybe from Westland, you're not feeling like you're part of that, but we are all part of that Metro Detroit area. And it is interconnected in a lot of ways. So kind of just learning about what your needs are in the community. Maybe that's talking to someone in your local community and knowing what you already provide and helping direct people to those things as well. And then getting involved in legislative action. I know this is a big one, but sometimes that's what people like. It's might be voting for something that's going to help change if animals are welcome in a certain area of town, or some of the legislation that helps keep people and their animals together. I know recently we talked about our changes to legislation with domestic abuse and animals and how they kind of are related, and how the outcomes of those are related. So being on, the voting side of that and using your voting power is another way you can help. All right, so just a couple takeaways before we finish up, and then we'll do some questions. Anything that you guys have in the chat, please go ahead and drop those in, and we'll get to them in just a minute. But some of the key takeaways, this whole overall idea of humane communities and trying to improve the connection between humans and animals is going to take a while. This is not something that's going to happen overnight. Although we've made great strides already, there's going to be a lot more that we need to work on, and it may never be done. There may always be improvements, but just keeping in mind that those little things that we can do to help with this are going to make an effect in this long marathon that we're all working in together. If you want to see the change, get involved. So again, trying those things. You guys are already doing that by being volunteers on your own, but if you want to know more ways that you can help, please reach out to us. Maybe it's not a one-off, maybe you just want to know how else you can do it. So please ask, and we want to be there. Understanding other people's struggles is key. It's a big part of this, is to be understanding and having that kind heart, open mind, and believing that we all are one community. All of us are working together to make this a more pet and human friendly place. So just keeping that in the back of your mind with everything you do. And I'm sure so many of you guys already do that as volunteers. So thank you so much. All right, so we are going to go ahead and pull open the chat. Let me see, can I open this one here? All right. Love everybody sharing all of their their things. But yes, if you have any questions about community vet, anything that we can do, please go ahead and drop those in, and we're going to go ahead and start answering a few of these. So I see one that says, are the cats and dogs that are in the unevaluated area as those who have animals, the same area as those who have animals that are there for vet service, or are they in a separate room? So that's a good question. So I can kind of start with this, and if you guys have anything to throw in, please let me know. It kind of depends on where you are. If you're at Westland or you're at Detroit, the unevaluated animals are animals that are not up for adoption yet. So they're still being evaluated. That's why we often refer to them as unevaluated animals. But they maybe still be going through their medical and behavior assessments before making their way up to the adoption floor. And for the most part, I would say yes, these animals that are maybe here with us and going back home can often be found in the same unevaluated spaces, because what we don't want obviously is for them to be on the adoption floor and be, you know, looked at by people and people going, I really want that beautiful husky, and we have to say no, they're actually going to go home soon. So often, yes, it can sometimes just depend on when they come in, what spaces are available in the shelter.
I wanted to, yeah, I just wanted to add just a quick point, because I'm not sure if this is kind of what they meant, because we have the veterinary center attached to our shelters. Yes. So if you bring in your animal to our veterinary center, they are not anywhere, and they have their own separate space, so they are not with shelter animals. I'm not sure if that was the basis of the question. So clinic animals that come in for vaccine, surgery, or need to stay, they have their own separate section within the clinic, not in the shelter.
Yes, thank you so much for clarifying that. I think yeah, it can be difficult if you've never been into the actual clinic spaces of either of our shelters. They do have spaces there that are like, if you're a guest for the vet, you will be coming in like just like a normal vet office would, and they would be housing your animal in that space during their like surgery, recovery, and all those different things that they'll be doing.
Yeah, they're separate spaces.
Yeah, my brain immediately went to like animals that maybe come in and they're in the process of, we found them injured outside, and then we found their owner, and we're working through that process with them before they go back home, is unfortunately where my brain just went, because we have a lot of that happening. So
next question was, do you do anything with gleaners in Livingston? That's actually a great question, Barb. I do not know all of the locations yet that we will be having pet food distribution out through, and some of those will be gleaners locations. I'm not sure if it's the one in Livingston, but we're hoping to partner with as many human pantries as possible to have pet food available for owners. So if they're already coming in for human services, they can get those supplies there as well. So we just had a meeting with the team earlier this week, the Community Solutions team, and they started to list off a few of our partners, but we don't have the full list of locations where that will be. So there will be more information coming out that will be probably in the newsletter, as well as a standalone email that'll go out to the volunteer body. And I'm sure we'll do a social post as that as well, and probably share that from time to time, because we want people to know where the resources are. Again, if there's someone in the Livingston area looking for food, they can still call our call center, so our animal resource center. And even if it's not something that we're able to directly help with, we are already directing people to other places where they can receive resources. So that was a good question. And if anybody has a question that's not in the chat box yet, you can also, remember, scroll down to the bottom, hit that reaction button, and there's the raise hand, and you can come off mic too. Looks like Emily had a question as well. Have the One Health events been scheduled for the year? Some of them have been, yes. So we just talked about, there is the first actual One Health event that Michigan Humane is hosting is on site at the Mackey Center in Detroit, and that date is April 12th. So volunteers can sign up to serve for those shifts already, and there has been information going out to community members. If people are calling and looking for services, our call center is letting folks know that these are an option if they're looking for lower cost services. So many of the dates have been scheduled. They're not all out, but if you guys know someone who's looking for a resource, again, calling a call center, they have all the pre-scheduled dates and kind of can help people get scheduled if they're looking for it. Once we get closer to, we will also have flyers that will be able to be handed out at the shelter. So if anyone is interested in more resources on that for like sharing out, please contact one of us on the volunteer team and we can get that information for you. If you are wondering too, can a family member, can a friend who qualifies for One Health events? Really anyone who has the need can call and inquire about scheduling an appointment to receive Pay What You Can services. So really good question. Thank you, Emily. Do we have any other questions? And you can type it in the chat, or really you can also just unmute and ask away.
Yeah, and I'd like to mention too, it doesn't have to necessarily be a question. If you want to mention, if you went to one of the events and you want to share how much you liked it, or maybe your own family has dealt with something and you want to share, please, this is a space that you're welcome to do that too.
I did have a question for Dr. Cece. So Dr. Cece, you mentioned that in Michigan, there are laws that require a veterinarian to establish an owner relationship. So can you talk a little bit more about that? It sounds like you were saying that that's a barrier, a struggle sometimes for getting veterinary services to an owner.
So during COVID, the state had relaxed the telemedicine restrictions. So you didn't have to have that face-to-face. You could actually do telemedicine and develop that client-patient relationship over virtual. But they just, on the 22nd of March, reversed that now. So if somebody calls and says, I have a dog and I don't have transportation, we're not allowed to bring the owner with the animal. And so my rescue department can't go out there and just pick up that animal and bring it in, because I haven't actually talked and seen the owner face to face and talked to it. So that is a barrier. So what the community vet allows us to do now is for me to go out and develop that client-patient relationship. So I talk to the owner, I say, we can pick up your pet, we can get it in. So sometimes it's for sterilization. Sometimes they can't get the pet in, and we know there's pet taxi, but sometimes they're busy and that's a little bit costly. So if I go out there and I develop that client-patient relationship with the owner, then I can actually come back in and have field services go out the next day, pick up that animal, get it sterilized and take it back and get that work done. So that makes it, having the community vet program makes that barrier a little less, because I can now go on the road and go actually to their home. And I will tell you, talked about the people at the One Health being appreciative. I think Doena can vouch for this, but everyone that we have gone to their home and helped them with their animal has been so appreciative, so kind, so glad that we were able to go out there and help their animals and help keep their animals. It's just, I can't even tell you how rewarding it is, the appreciation that we get every time we go out.
Yeah, and I wanted just to point out, because I didn't mention this, it'd be good to know since we kind of started this program, that we are at about 55 homes that we have helped, and over 100 animals right now.
And when did that start? Was that the beginning of this year or since the program started?
It would be since the program started last year, like the beginning of last year. Started off extremely slow, so a good portion of that has been this year. Actually, like 50 something has been this year, so a lot of it's been this year.
Very cool. Emily, you have a question you want to unmute?
I do, yes. Kind of going off of what Dr. Cece had said, I heard that there is kind of going towards what had previously happened with COVID and the virtual veterinary appointments, and that with the relaxation on that law. And now we're flipping back to that. I heard that there's kind of going to be some opposition with like state legislation to go back to that relaxation. I just want to know, where does Michigan Humane kind of stand on that whole political issue?
So I guess I would have to, I don't really know where the Michigan Humane Organization itself stands.
Mm.
I don't know if we're like in the mix on that. Some things that we do get involved in and some things we don't.
Mhm.
And right now, I don't know if we're lobbying for one way or another. I know that there are some pretty big organizations that are fighting that, like the Humane Society of the United States and their vet medical association associated with that are fighting that, because I've gotten emails, but I don't know honestly if we have an official stand or if we're just kind of sitting back and seeing what happens at this point.
Okay. Thank you.
That's actually a great question, and I'm glad you asked that, Emily. We can follow up with Ann Griffin, who is our director of advocacy. She will be able to answer that question. So we can put that in the follow-up. Great question. Because I would like to know too.
Okay, I don't know if anybody else will just check for hands real quick.
The other thing I wanted to add too is, we talked about how community vet helps reduce parvo, distemper, pan-luke, and it's not only for those pets that are in the home, it's for the community as a whole. Something that really overburdens shelters is maybe there are stray animals out in the community, right, that can pick up these viruses, or outdoor animals that can pick up this virus, and it's not necessarily from that home, right? Can't these viruses live out in the community? And the more vaccination that we do kind of can prevent more animals from coming in the shelters, even if they are, and more illness that can kind of affect shelter populations, even if these animals aren't coming in. Can you talk a little bit more about that, Dr. Cece?
Yeah, so we know that just like any disease, like in the flu, in people, if we get a certain percent of the population vaccinated, it lowers the risk of everyone getting that disease. So the more animals that we can protect, the lower the rate of disease are going to be in any given population. And that's a cutie there. Oh my gosh. Look at that. Where'd that hair come from?
Oh, Jen, you're on mute. I don't know if you were saying something.
I know he's clicking buttons, so we're like going all over the place on my screen. It comes from both my husband and my side of the family. I didn't get the red hair, but both my brother and sister have it. So yeah, thanks.
All right, well, if we don't have any more questions, it is a few minutes past 8 o'clock, so we're going to let you guys go, but I want to just give a huge thank you, obviously, to Dr. Cece and Doena for sharing this information with us. I learned a lot. Working with you guys on putting this together has taught me a lot, so thank you so much, and I hope their volunteers had a great time. Thank you, volunteers, for all being here and doing this with us. There will be a follow-up email probably sent out tomorrow with links to a lot of things related to this, as well as videos that Michigan Humane kind of has related to some of these topics. So keep an eye out for that email, and it will also have the recording for anyone who needs it. So thank you guys. Thank you for the nice things you're putting in the chat, and I hope you have a great night. Go ahead and sign off when you're ready. Thank you.
And I want to just thank all the volunteers for everything that they do. We couldn't be here without you guys. We love you all.
I will second that.
Thank you guys for what you do to help keep our organization an inclusive space for all types of pet owners. Again, that means so much to me personally. And it really is true that you don't need to be someone special to own a pet and to be able to give them love. So thank you for what you guys do going out in the community. And thank you, volunteers. We love you.
Thank you guys. Have a